Good evening, everyone, and thank you so much for joining us tonight for Let's Talk all about COVID vaccinations for children 5 to 11. Before we get started, I want to let you all know that if you'd like to access this presentation in Spanish, you can click the Zoom, the button on your Zoom invitation that will interpret it into Spanish for you, or you can access the presentation via the Health and Human Services page, which is in Spanish, and then the English version is on the Buncombe County page, Facebook page. I'm Megan Williams, a Buncombe County resident and the mother of 4 children who attend Buncombe County schools in Buncombe County. I'm happy to be here to talk with some of our local experts about the Pfizer COVID-19 vaccine that was recently given emergency use authorization for the 5 to 11 age group. In addition to being offered in Spanish, we're also offering American Sign Language interpretation services tonight. Thank you to our Spanish interpreters, Rocio Quintero and Ada Volkmer, and our ASL interpreters, Crystal Bradley and David Herman. We are so grateful to you for your assistance in making this information accessible to our Spanish-speaking neighbors and our non-hearing neighbors. We hope to answer all of your questions tonight in this session, but if not, please put them in the chat, and we don't anticipate that we'll have much time at the end to answer the questions that come up in the chat, but we will put together a FAQ document that you'll have access to later. So I'm here tonight with a great panel of local experts, and I'm excited to talk with them. Panelists, could you please introduce yourselves? Start with Dr. Wade.
Good evening. I'm Dr. Lorena Wade. I work at VIA Health, which is our region's behavioral health LME MCO, and there I serve as the medical director of integrated care.
And I am Brian O'Donnell. I'm one of the local pediatricians. I've been at Mountain Area Pediatrics for about 15 years now. I'm also the parent of 3 kids, a 10 and a 12 and a 14-year-old that are also in Buncombe County, in this case, the City of Asheville schools. And I'm happy to be here tonight.
I think I'm up next, right?
Yep.
Hi. This is Stacy Turpin-Saunders. I'm Public Health Director for Buncombe County and also mom of 2 children, one who has already been vaccinated and one who is now eligible, and looking forward to talking to you all about vaccines tonight.
Hey, I'm Syncama. I'm April Bauer, and I'm the program manager for the MAHEC School Health Program with the school nurses. And I have 3 children, one of whom is actually an adult, amazingly, and is vaccinated, and 2 who are school age and just now eligible for the vaccine.
Great, thank you all so much for joining us tonight. So we'll go ahead and get started. The first question I'm going to throw to Stacy. Stacy, can you share some information about how the vaccine for this 5 to 11 age group is different than the vaccines that are currently available for people over age 12?
Thanks for the question. And so I think what I'll do first is just sort of start with a recap of what vaccine is available, because now we have lots of different vaccine and different age groups that are eligible. And so just to remind folks that we have 3 different vaccines, and that's the Pfizer, the Moderna, and then the J&J. And all 3 are, for all 3 of them are 18-year-olds and older are all eligible for those for our adult population. And then when we get into 12 to 17-year-olds, only the Pfizer, and then also now with our recent eligibility, our 5 to 11-year-olds, only the Pfizer. And so to answer your question, the pediatric vaccine is just like the adult vaccine. It utilizes the messenger RNA as sort of that catalyst to initiate an immune response. And the simplest way to say it is the messenger RNA. Sometimes folks will say mRNA. Vaccine teaches our cells how to make a protein that will trigger our immune response inside our bodies. And like all vaccines, the messenger RNA vaccines benefit people who get vaccinated by giving them protection against actual illness without risking getting the illness, where consequences of getting sick could could be very, very diverse. Specific to the COVID-19 vaccine available for children, one difference is that the dose for pediatrics is smaller than the adult dose. Our adolescents, meaning those who are like ages 12 years and older, they receive the same dosage of the Pfizer vaccine as adults, but our children 5 to 11 years old receive an age-appropriate dose that is 1/3 the amount of the adult dose that we see with the Pfizer vaccine. And that lower dose minimizes side effects, but still prompts that strong immune response. And for this particular population, when we think about children, in general have robust immune response. Unlike as we get older, sometimes our immune system doesn't quite elicit the same type of or the same robust immune response. So a little can go a long way for our children versus older populations where we need that higher dose to get that robust immune response. And I guess I'll also just say that, for the Pfizer vaccine for children 5 to 11 and for the adult version, it has the same ingredients, same active ingredients as the vaccine given to adults and adolescents. What we do, or what you will see, are smaller needles, obviously smaller bodies, so smaller needles designed specifically for this particular population. And just like the adult version, there will be the need for a second dose.
All right, thank you so much. So if kids are somewhat less likely to get severely ill from COVID, why do they need to get the COVID-19 vaccine? And I'll direct this one to start with at April, please.
Yeah, so I think there are several reasons that it's important for this age group to get vaccinated. So the first is, although they may be less likely to get seriously ill with COVID, they can become severely ill. There certainly are children who have been hospitalized in the ICU and unfortunately have died from COVID. So it's still a possibility. I think we also, I think Stacy alluded to sort of risk versus benefit. And we know that there are risks to contracting COVID, whereas there are very little risks from the vaccine. So there's always sort of that risk benefit analysis. I think also for children, there is the potential for complications from COVID, just like with adults. So for children in particular, they can get something called multi-system inflammatory syndrome in children, or MIS-C, following a COVID infection, and that can be life-threatening. So we would want to prevent that if possible. And again, although they're less likely than adults to experience this particular complication, they can get long COVID, which is where they can have those lingering symptoms after a COVID infection for a long time, anything ranging from fatigue to respiratory issues. So anytime we can prevent illness, I think that we should. And then, too, just like with any age group, vaccinating, kids ages 5 to 11 protects them, but it also helps to protect our larger community. I think, everybody is really eager to be on the other side of this pandemic, and vaccination is one of the best ways for us to get there.
Megan, do you mind if I add to that a little bit?
Go ahead.
As we think about it too, I come from a family practice background, but I work in a behavioral health organization. And I also just note too that the impact that this has had on all of our lives, with the stress and the anxiety it's caused, the depression that people are suffering. And we know it's even had more effect on anybody, children or adults, who had something in a pre-existing situation. They already had ADHD. They already had some anxiety or depression. And so I look at this too as a way that we know that getting those kids back into the school and consistently keeping them there in the school is one of our first steps for their mental health in that respect. And also a lot of the services they're receiving are in those schools, and getting vaccinated is just a really big key to keeping them at school and not having all those days that they need to be absent or And I commend the teachers who have done the remote learning and the administrators who figured it out, but it's not the same.
And Megan, can I say something as well?
Yeah, go for it.
All right, just from the primary care medical side, I'll just say that I think for some of us, you may be getting your kids ready for dinner. You might be getting picking them up from after school programs. So I'll give you the Cliff Notes edition, but I think it's safe to say, and we'll prove this a little bit later on, that number one, COVID is prevalent. I think sometimes we forget that we've had 6.4, probably more than that at this point, million children infected with a positive test. Maybe they're not that serious, but 1.3 million of those have been even since the beginning of school. So the numbers are going up. You know, it could be even 24, 26% of the total cases. And then also, I think that the Cliff Notes edition is that I think COVID has bad outcomes. You know, we forget about that. Mortality isn't the only outcome problem. Yes, there's only like 0.2% of the COVID-associated deaths are children, but it's still higher than a lot of other reasons why kids die. In fact, I think it's now 8 on the list, number 8 in terms of pediatric deaths per 100,000 kids over the last year. And so I think that there is that. But also that you have hospitalizations, like we were mentioning, the COVID-associated long-term effects. And I think that probably one of the more important things is that we have a vaccine that's safe, and we'll talk about that, but that's safe, that's effective, but it's not going to be effective forever. And one of the problems that I think about is that coronavirus love to mutate. That's why we have colds. And we have this window of time where we have a vaccine that's effective, that does a good job, that I will argue that is safe, and we have this opportunity with a pediatric population that sometimes sees the worst outcomes of COVID. That MISC that April was mentioning is something that you see peaking in the 5 to 11 age demographic. In fact, the multi-system inflammatory syndrome peaks at age 9. And these are kids that have not had the opportunity to have the vaccine up until this point. So I think we have this window of time where I think that now is a good time to consider, weigh it for your family, and I think it's a wonderful vaccine at preventing some serious outcome problems.
Thank you for all of that information. And so regarding side effects, because we've heard, or if we've gotten the vaccine ourselves, or if we've heard about others, we may have experienced some side effects with that. And I can understand why some people might be nervous about that possibility for their kids. So what should we expect in terms of side effects for kids, and should we be concerned about them? And I'll punt that to you, Dr. O'Donnell, if you don't mind.
Yeah. Thanks, April. This is a weighted question because there's a lot of side effects that people will see and hear just from regular vaccines and from personal accounts. But first, I'll just talk about the study. The study was done on initially it was done on 2,200 kids, 2,268 kids, and they were followed for a good 2 months. 1,518 got the vaccine. They added another 2,300 children to that number to bolster some of their numbers, and so a total of maybe 4,600 children got enrolled in the study. 3,000 plus were vaccinated with the Pfizer vaccine. And the first group was followed for 2 months. The second group was followed for 2 to 4 weeks. Up at this point, it's a little bit longer now. And people always ask me, is that enough time to see side effects? And the majority of side effects that we see, including even in the chickenpox vaccines and the measles, mumps vaccines, the majority of side effects you'll see in the first 4 weeks. Now, there's some other ones that we see down the road, and we'll talk about those a little bit in terms of inflammation. But out of that, the effect of that vaccine in terms of how effective it was in terms of creating antibody responses and antibody numbers was somewhere in the realm of 90.7% effective in preventing COVID disease. And probably more important is it was effective against Delta, of course. And what we needed to prove was that it had something called the immunobridging, which was similar to the vaccine that was done in the 12 to 17-year-old age range, as well as in the adults. And so as far as we can tell from these studies, it actually shows a really good effect at preventing severe outcomes from COVID. It's not going to prevent you from catching COVID, but it's going to prevent the severe outcomes that we see. Now, to answer your question specifically, Megan, is that you do see side effects, and there's the common side effects where you get muscle pain and swelling. About 39% of kids got fatigue, another 28% got headaches. And then there's a 10 to 15% that got myalgias, which is muscle aches. You got joint pains. In fact, we actually saw lymphadenopathy. You see some big lymph nodes in a decent percentage of these children as well. And we consider that to be pretty normal findings after a vaccine. It's a good immune response. The other things, which just to show you how comprehensive these studies have to be, is that apparently other serious side effects is one child swallowed a penny, another person broke a bone, and another child had an infection of a joint. And those are obviously unrelated to the vaccine itself, but we have to report everything that happens in the time period after you get the vaccines. Probably the more important question, Megan, is should we be concerned about those side effects, and maybe even the side effects that we don't know about? But I'd like to I'll probably change the dialogue a little bit, in the sense that I'm not comparing the vaccine side effects versus nothing. I'm usually, when I'm talking to people, I compare the vaccine side effects versus COVID disease itself and the side effects that we get. And we've already talked about some of the bad outcomes from it, but I'll give you one example I think is probably pertinent, and that's specifically myocarditis and pericarditis. And that's inflammation of the heart, where you get inflammation of the muscle cells of the heart itself or the sac around your heart. And we know that children get this. They get this from viral infections, and I should separate this. There's a virally induced myocarditis where you get specifically enteroviruses. It's a kind of virus that likes to get in your GI tract that will actually infect and get into your heart muscle tissue. And as you clear it and as you attack it, it damages your heart muscle. Now, that is quantifiably and clinically different than the myocarditis that we're talking about with immunity or vaccine-induced myocarditis. And that is where, while you're fighting off a viral infection, your immune system is attacking it so robustly that it also starts to cause inflammation around your heart and in your heart. You're not getting damage to the cells themselves. There is some secondary inflammation, and you do see some side effects from that, but it's less intense. You typically don't see the death rate that you see with a viral infection of your heart. And so what we see with that is a baseline is that children typically will have maybe 9 per 100,000 kids in a typical year will get virally induced myocarditis. With the vaccine, the numbers are slightly different, but there were 62 cases, this is in the 12 to 17-year-old range, 62 cases of vaccine-induced myocarditis or pericarditis per million kids who got 2 doses of the vaccine. Now that is actually the same or less than the background rate of myocarditis that kids get on a regular basis. But if you compare that to the disease, so if you get COVID disease, we see rates, and I'll double check this just to make sure, but it's 16 times that rate. So a child diagnosed with COVID has a case rate of myocarditis of 150 per 100,000 children. It's dramatically larger. And it's somewhat intuitive in the sense that if I give you some spike protein in your arm and you form an immune response to that, and that immune response gives you some inflammation in your chest, which typically is short-lived, less than 5 to 7 days. Kids, no one's died from that, by the way. So we have reports, we're actually following up on it. There's NIH studies, but nobody's actually died from that myocarditis. But it's supportive care, you get better, and kids recover from that. But if I see that compared to the same exact condition, but with a much more serious outcome, with longer hospitalizations due to the COVID itself, I still think that the benefit of a vaccine in terms of both avoiding the long-term outcomes of COVID, but also even the myocarditis itself, it's a moot point. The evidence supports getting the vaccine to minimizes your chance of even the myocarditis.
Thank you so much for that. So it's sort of like a risk benefit is kind of what I'm hearing from you, is that it's really, you really have to compare what would be the risk of getting the vaccine versus what would be the risk of getting COVID. I've also our next question is going to address kind of this question about natural immunity versus vaccine acquired immunity. And can we first sort of shed some light on these terms to help us understand the differences, if there are any? And I'll start with Dr. Wade for this one.
Sure. So I think when people commonly refer to natural immunity, what they're talking about is if they have been infected with the virus. So at this point, we're talking about COVID. So they've been infected with COVID and created a natural immunity. Versus when we talk about a vaccine-induced immunity, when the vaccine has been injected and it has given you that immunity from there. I don't particularly like calling it natural immunity because really both of them are your body's natural reaction to something that it's been exposed to, and that it, like in instance of the vaccine and in instance of COVID, it's that spike protein. And so your body says this is foreign and it creates a natural immune response. So in one sense, I think that it's not probably, I think it probably just sheds a light that makes us think that we're in somehow something different is happening once we get the vaccine. That spike protein that we are exposed to, or through that mRNA, that is gone within at max 72 hours. And what you have left is your body's the antibodies that your body has created to then address COVID immediately if your body is exposed to it later. So I think that's one thing to start with, is just that I think that creates some confusion. And then I think that the other thing about the difference in those in the exposure, like where's the risk in the vaccine? And so we've talked about some of the things that we think are risks and side effects of the vaccine here tonight. But then there's also the risk of being exposed to the virus, to COVID, and the risk then of severe illness or death. And it's small in children, but it's real. And as I always say to my patients, I tell them a risk benefit analysis. I say maybe, the risk of you getting this is 12%. But if you're the person who gets it, it's 100% you. And that's true with any of the side effects and any of the exposure that we have to this virus. And so we have to look at that. And so there is a real risk of severe disease. And that's precisely what the vaccine was developed to do, is to prevent the severe disease and to prevent death from the exposure to the virus. So I don't know if there's something else you wanted to go into on that, Megan?
Yeah, so I have a little follow-up to that. So how does the vaccine then play into transmission of COVID-19? Does it provide some protection against transmitting it to others?
It does. And these are difficult numbers to give a solid number. In the overall scheme of things, we are, as we know, early into this virus. It's only been around, for this short time. And so the things that we're doing, I think that they're all of the information that we're getting has been based on science, and we're exploring it in a very sound and scientific way. But of course, our knowledge base is growing as we move forward with this. We're not in a lab. We can't separate these things out and say exactly this is how many days or in that respect. So what we know about it, though, is that yes, if you get infected with the virus after you've been vaccinated, then we do know that you can transmit the disease. But it appears as though, the best that we can with our knowledge at this point, that it's probably with this variant, probably for about 6 days or so, you can transmit the disease after you're infected and you've been vaccinated. Versus if you're exposed to COVID and become ill from a natural exposure to the virus, it's probably closer to 10 days. So it does diminish the amount of transmission that you can have. The other thing to note is the vaccine prevents disease in a lot of people. And so noting that means that there are fewer people that you are exposing it to. So we have to take that number into account too, that there are fewer people who are vaccinated who are getting it. But if they do, on average, we think they probably are able to transmit it for about 40% last time.
Okay, thanks for that. So what about kids that have already had COVID? Do those kids still need to get vaccinated? What would be the benefit of that?
And that's true across all of our age groups. Yes, that's the short answer. Yes, you should be vaccinated even if you have been infected by COVID. But it's also not a cut and dried answer. It really depends on, first of all, when your infection was. We certainly don't want somebody coming out who should be in isolation and getting a vaccination. We don't want somebody who is just still very symptomatic from it getting a vaccination at that point. But that's a discussion that can be had on an individual basis with your doctor. And so we do believe that the more severe the infection, the more antibody response that you have, maybe the longer that will last. And so that's taken into account when we talk about when it should be. On average, I would say that the general rule of thumb is within 90 days of an infection, you should be vaccinated. And that's been the general rule of thumb from the beginning. But I think that each individual case is playing out a little different in that respect.
Okay, so
Megan, can I comment too?
oh yeah.
Yeah. I just wanted to say that the problem with the COVID disease, when you actually contract the disease, there's such a variability in the severity, how much you got inoculated by. So, for example, if you have I have several children who have had really what I would consider to be a high rate of infection, got very sick with it, high fevers. Those kids probably have a really robust immune response. So when we get this data on how long you maintain immune memory, how long their antibody responses lasts for, it seems like it's widely variable. In fact, not to be defeatist, but there's reports that the vaccine works better than natural immunity, and I'm not going to go into that very much because the problem with that is that there is no way of quantifying your natural immunity or what people get from catching the disease in schools or at home, because you just don't know how much they catch. It seems like disease severity and immune memory of that disease widely varies depending upon how sick you're getting with it. So the problem that we run into is that kids who are mildly symptomatic, which is still a lot of children, the question is, if they test positive, how long should we consider them to be immune for, and when should we give them a COVID vaccine? And for CDC purposes, they have to make one rule fits all. But I'm just going to say that I usually use a lot of clinical judgment and just figure out how sick you are. And if you really didn't get a severe version of COVID, or you tested positive and you didn't know you had it, I really can't tell you that your immune memory is going to go very long. And so those are the kids that I consider actually vaccinating on time, meaning that within the 90 days, kids who are really sick or who get a big response to the first vaccine, we can always tailor that depending upon your own immune response. Thanks.
So what I'm hearing you say is the immune system is incredibly complex and that it varies.
Right.
Basically, right?
Right.
Okay, so one of the other concerns that I've heard from other parents about the vaccine is whether it has long-term health impacts on their children. I know you've touched on this already, but is there anything else you wanted to say about this particular concern?
So I can take this
Dr.
first.
O'Donnell,
I think I was up for that first. And yeah, I'd be lying if I said we know long-term effects. I mean, there's no real way. The studies that we have are all based off children getting this within the last 2 or 3 months, and so I can't tell you that we have no long-term effects. I'm still going to change that dialogue a little bit, and I say that we also don't know the long-term effects of having COVID. So we still see plenty of long COVID symptoms. We still see, and I should mention this, the long COVID children. Children's form is typically 7 to 8% of kids who get a severe case of COVID will end up with some insomnia, some forgetfulness, what we call the fog, and even have long-term headaches for more than 4 to 5 weeks. We don't even know if that's going to be long-standing. We hope that it won't be. So I think that the COVID itself has a potential for some long-term effects, and I think we already got some education on how the vaccine works. And so if I have a certain immune response to spike proteins that I have a defined amount that I put in my arm, then any any serious disease that you have that has maybe millions of times that amount of spike protein and such, and the similar immune response will probably cause the same, if not worse, vaccine outcomes. But I will mention that some of the things that we've been looking at, from the medicine side, was that, of course, I'll debunk some of the things that, of course, we got worried about microchips. I'm not too worried about microchips or magnetic potential. There's no live virus in the vaccine, so you're not going to catch COVID from the vaccine. One of the main ones that I've seen or I've heard about is menstrual irregularities, so menstrual cycle changes, and maybe even questions about fertilization and fertility risks. And so I'm not going to say that we have a plethora of data on that. We don't have a ton of information, but I will say that we have a couple of studies that have already started addressing this. So the first one is done, well, both of them are done within the last 12 months. In fact, they finished up in August. And the best way of us being able to figure out if it really does affect fertility is looking at a controlled environment. So the only way we can really do that is typically to take in vitro fertilization, where you take an egg, you fertilize it outside of the womb, and you implant it in the uterus itself, and see what the success rates of having a viable fetus after that. And out of the women, 2 different studies that had that done, people who had the COVID vaccine versus people who did not have the COVID vaccine achieved the same exact fertility rates, the same exact success rates. And that was done both with people that we weren't sure of their COVID status, and then they got the COVID vaccine, and people who then were tiered out into having COVID, having a COVID vaccine, and then adult women who had neither. And it still seemed in both of those studies to maintain exactly the same fertility rates. Unfortunately, with menstrual irregularities, there's no way of knowing what will cause those menstrual irregularities. There's a lot of stress. If you get a vaccine, there's also stress about what you did to your body. And so I can't tell you that we know why you have menstrual irregularities, and there's a lot of anecdotal reports. I can say that the NIH is looking into that right now, which is all the National Institutes of Health is looking into that to see if there is something that they can find as a reason for that. But we have no answers for that. And one other study that I'll mention in terms of fertility is that men who got the COVID vaccine in a recent study as well showed that they actually have the same exact sperm rates, viable sperm. If you had the COVID vaccine, you could check sperm before you got it and then afterwards, and then also people who did not get the COVID vaccine versus people who did. And so we've seen the same sperm counts and viable sperm regardless of the COVID vaccine, which for me answers a little bit of a question, which is that I don't know why we have the menstrual irregularity reports, but I do know that one way or another, it doesn't appear to affect fertility in any way. And the last thing is that I will say that if you have vaccines, like if you have vaccine side effects that are related to the child's immune system in the response to a vaccine, and then you have this uncontrolled amount of vaccine or amount of virus that you catch in the same inflammatory response, that I still will argue that a vaccine with a defined amount of immune response is far better than getting COVID itself. And I'm pretty sure we will all catch COVID in the next 12 months or get a vaccine for it.
Thank you. Does anyone else have anything to add to that particular question? You covered that really well, Dr. O'Donnell, thanks. All right, so another thing I've heard from others is some version of COVID-19 isn't that serious, or we need to learn to live with it like the flu. Is this true? And what does the latest information show us about COVID in our community? And I'll direct this one towards Stacy Saunders.
Thanks, Megan. Sorry, it took me a second to come off mute. So yeah, I hear that too, that, COVID-19 isn't that serious. Isn't this just sort of like a different version of the flu? And no, it's not a different version of the flu. COVID-19 is very serious. We've experienced, I think at the last time I checked, almost 47 million cases in the United States, and well over, we're getting close to 800,000 of our friends and family and neighbors here in the U.S. that have died of COVID-related illness. And, and if I also think in the previous year, we saw COVID-19, I believe, was the third most common cause of death in the US, only to be, it's only behind those really heavy hitters like heart disease and cancer. So that's a pretty serious title to have for an infectious disease, and certainly makes it stand out from seasonal flu in a lot of ways. And I also, when, I've been in the pandemic response now for, I think, 20 months. And I remember the very, early days when we were first identifying folks who had COVID illness, and those symptoms and learning about the different symptoms that and how hard it was hitting people. In the early days, we knew each and every one of those folks, and I remember the first death that my community at that time experienced, and feeling sort of the gravity of what this could be. And here in Buncombe County, we're still in a time of very high transmission in our community, and that means that COVID-19, while we're seeing cases decline right now, it's circulating among us in really large amounts, and predominantly it is the predominant respiratory illness right now that is circulating. And so while encouraging, those case rates are decreasing, and that's very encouraging, and no one's probably more excited about that than I am, to see those case rates decrease. We still have quite a bit of transmission and spread of COVID-19, not just in our community, but in our entire state. And I consistently say that pathogens do not know these man-made constructs of a county line, and so we're just as vulnerable as the transmission rates in our neighbors' counties, as well, as we travel back and forth, and sometimes folks work in one county and live in another. And I'd be remiss to sort of say too that I still think about COVID in a really serious way, because we're about to embark on several holidays in a row. And what we've known over the last 20 months with COVID is that we do see an increase and often a surge in cases after major holidays, where folks tend to get together with family and friends. And so I think we're really hopeful that with vaccination rates beginning to get higher, and that we will not see those mountainous peaks of cases that we saw last year. But nonetheless, we anticipate that we'll see an increase in cases as groups of people celebrate together. And that is our reality right now, that we're entering a time of the year when group gatherings are quite high, and we're entering that time and space at a really high level of transmission. So it can be it's a fairly precarious place for me to be thinking about right now. But to your question about why, I hear that too a lot about shouldn't we just go on with our lives and live with it. And I do think that we'll have COVID-19 in our lives for the foreseeable future. I do think that. And I believe that we can find ourselves in that space where we control and manage the spread of COVID-19. And this means, from a public health standpoint, this means achieving those low levels of transmission and sustaining those low levels of transmission over long periods of time, where we are seeing that consistently at a low level. And achieving those low levels of spread, it means that we have to protect ourselves in our community, and one of the best ways we can do that is through vaccination. And the more that we're protected, this is sort of the corner, some of the foundational work of what public health is about, particularly when you think about over the last 100 years and the strides that have been made around infectious disease. The more we're protected as a people, and as a community that extends even outside of our county lines, the less we allow the virus to infect us and continue to control our lives. And so we're at this, what I believe, I think we're at this really pivotal moment right now, that we can achieve a place where we control and manage COVID-19, where we, can live our lives with this virus circulating at low levels, and that we begin to look more like what our lives did before COVID. And like I said, in the last few weeks, to me, it feels like a very pivotal moment, that our vaccination rates are increasing right now. Our children, most of our children are now eligible. Transmission rates are declining. And so I'm hoping, and I'm, hoping as we approach the new year, that we find ourselves in a space where we are controlling this virus and controlling this illness, and not the other way around. And that continues to take a commitment as a community to protect ourselves through vaccination, and possibly those layered protection measures, most certainly at least through this holiday period, while we're still experiencing high levels of transmission and spread, and just now getting to the vaccination eligibility for our pediatric age group. And so, I hear folks when they say, can't we just live with this? And I do think we'll have COVID around for a long time. I do think we'll likely get to a place where it's much more endemic. And we are approaching that, I believe. But in order to get to that space, it means getting it to much lower levels than we have right now with spread and transmission, so that we are controlling and managing that, and not seeing large surges of cases that then, put our community and our neighbors and families and friends in jeopardy of severe illness, hospitalization, and then the worst health outcome being death.
If anyone else wants to add.
Yeah.
Go ahead.
When I hear people talk about the comparison of COVID and flu, I mean, I know why we compare it. They're both viral infections. They both can cause mild, moderate, severe disease. We can infect people before we have symptoms. And we don't even know we're unknowingly infecting people. So I understand where some of the similarities lie on that. We are showing over the course of this time, that as compared to the last many years of flu seasons, that the death rate from COVID is substantially higher, maybe 10 times as high as death rates from COVID infections. So I think that's one difference in points there. But for me, the other point is I am a strong believer in immunization for flu vaccine also. And vaccinations with flu have been something that for years I recommend, I personally take, my children take. So I also want to say that this isn't unique to COVID, that I think vaccination is an important way to stop a communicable disease. There are a lot out there, and I think that vaccinations on the whole are really important.
And Megan, can I say something to that too? Thanks. I think that I agree with everything that's been said. I think that COVID isn't the flu. I think it's more serious. I think it's like the flu. I think that coming up into this winter, we'll see more transmission. You'll see the numbers go back up. We're already seeing that in Europe. Some of the numbers have started since it's getting cold. We've started seeing some of the numbers in Europe starting to climb again. We have a sustained kind of infection rate right now. No, it's not horrible, but it's there, and I think that it's not going down. So I do think that we're setting ourselves up to see a little worsening, maybe a grand worsening this winter. But some of the things that I usually consider, especially as we get into the winter months and with the COVID itself, is that I think that we don't need to be personally touched with a bad story about COVID. Now, here in the clinic, I hear a lot of bad stories about COVID, about young people who seem to get really nasty versions of the disease without any comorbidities or without anything to set them up for that. And it's not, fortunately, in my pediatric population, but it's definitely in families and grandparents for sure, but also relatively young people, 40, 50, 60. And yes, I'm talking about people that are tangentially related to my pediatric patients. But we are talking about now a population of kids that are in a school environment where we will continue to see smoldering of COVID for probably the next year. And this is a captive population, a population of kids that I think could really alter the course of COVID. And I'm still going back to the fact that I really believe that this vaccine is a good vaccine. It's far better than the COVID disease, but it also helps so many more people. And I think that we can't forget that that I think it's a team approach. Yes, it's our children. Yes, I think it's safe, but I also think that the benefit is far reaching. It's not just on your particular child. And I think we can understand that, you don't need to have somebody specifically in your family that's had COVID to know that COVID can really have dire consequences.
And I will say that it seems as though kids have an intuitive understanding of this, because I mean, when my children heard that they were going to be eligible to get the vaccine, they were proud and excited, and which is really strange because usually that's not their reaction to vaccines at all. So I think they kind of understand that, just sort of the largeness of this pandemic, and that they can do something too, which is nice for them developmentally. So, okay, so if we were wanting to get our kids vaccinated in Buncombe County, what would we need to know in order to do that? Stacey?
Yeah, I think I can start and then welcome others to chime in as well. That just like with adult vaccine, we have lots of vaccine providers in Buncombe County, and that there is a North Carolina website, Find Your Spot, that can help folks find a vaccine provider close to wherever they work or live, or whatever is most convenient for you. And that's as easy as putting in a zip code and finding a vaccine provider near you. And when I say we have lots of vaccine providers, that's not just a local health department. That includes pharmacies, many of which are located in convenient areas like grocery stores, like your Ingles, but also includes some of our family practice and pediatrician offices. Some of our federally qualified health centers also have vaccine. And so it's really important to think about where is the space that you want to get your child vaccinated, because they vary. Like I said, there's opportunity within what we would consider sort of a traditional doctor's office, but there's also an opportunity for access at your grocery store or local pharmacy just down the street from you, or at one of our community events. And so in addition to, so at the health department, we're able to administer any of the vaccines that are available. And that does mean for adults, which are all 3 types, and then the pediatric doses as well. We started administering those last week, as did lots of vaccine providers. So you can visit us at the health department, and beginning next week, we'll be administering at the health department Tuesday through Friday from 9 to 4. But also next week, we are starting our outreach into the community as well, and building on the success that we had with our school partners throughout the vaccine rollout. And we'll be moving around to different schools every week, and we'll start on November 13th at Asheville Middle School, 9 to 4. But in addition to that, and then every week we move to a different school, and those are listed on our website. And just to get some geographical distribution, we want to make sure that if folks are wanting to get their child vaccinated, that they have the opportunity to do so. So we'll be centrally located first, and then moving out into other geographical areas of the county for folks. And even though those are going to be located on public school campuses, anyone in the community is is welcome to come, because we'll have not just pediatric doses, but other doses available too. And what I've found, and what I'll be doing is what we found in our clinic last week is that when folks are bringing in their kiddo for their vaccine, a lot of times the parent or caregiver is coming in for their booster, or maybe even their second dose or their booster. So looking at it as a buddy system almost, and that's exactly what I'll be doing with my 10-year-old, and when he gets his vaccine this week. But in addition to the outreach events that we're going to be hosting, we have other partners who are also doing other events, including the North Carolina Department of Health and Human Services has a state-supported site, which is going to be, it started November 6th, and it's at the Eddington Center on Livingston Street, not far from Mission Hospital. And they're providing all vaccine types as well, with a focus on pediatrics. And then our partners at MAHEC with the FEMA resource also have, will also be doing some school outreaches in December. And so we have lots of opportunities. And as I said, sometimes the easiest thing to do is to check out Find My Spot website, put in your zip code, and lots of options will come up. You can also check out our website, the Buncombe County HHS website, to learn more about where we're going to be throughout the next 4 to 5 weeks.
Okay, so we're coming really close to the end of our time. So I was just hoping that maybe all of the panelists might weigh in on this one. If listeners, those that are with us now and those that might listen to this later, could leave here with only one piece of information, what would you want it to be? I don't know, Stacy, would you like to start off with that?
Sure, I can kick us off with that one. And I think I mentioned a little bit earlier that I do think this is a pivotal moment. We have an opportunity, and that's pretty exciting. As I mentioned, my son's getting his vaccine this week. Our whole family is pretty excited about that. Once he's vaccinated, that means that, everyone in my family will be fully vaccinated, and that, opens a lot of doors for us, I think. And in general, the pediatric vaccine eligibility feels like a really big moment for me as a public health professional, but as I said, like also as a mom. So as we're getting kiddos vaccinated, while we're in that process, one thing that I really have to continue to remind folks, or feel compelled to remind folks, is that we're still in a time of high transmission. Those cases are coming down. That's really exciting. We are entering a holiday time period, and so I just want to remind folks that as we're in this exciting time of vaccinating 5 to 11-year-olds and moving into our holiday season, it's really important to remember to rely on other measures, those layered approaches too, while we continue to vaccinate folks, like our face coverings and keeping distance. And those simple steps really do matter. And so particularly as we're seeing high rates still of transmission.
So, Megan, I'll say that I just hope as if somebody's watching this later, somebody who's considering having their child vaccinated, that I hope they take with them the fantastic brains that have worked on this, the science that has gone forward, the ability that we were able to just immediately sequence this virus and move forward with something that really can change this course. And so for our children, I take forward that that science, and just having those trusted advisors that you've had in your life before COVID too, whether that's your pediatrician or family practitioner or the leaders in the science, and using those people to be your ability to work through some of your fears and some of your questions with them. I think that's just a great thing that we have access to that.
I'll go next, so I don't have to go last. And just say, that I think, like I said earlier, all of us are really ready to be back to something closer to normal, more on the other side of this. I think vaccination is a great way for us to get there. We know these vaccines are safe and effective. So, like Dr. Wade said, for anyone that has questions, talking to your healthcare provider, seeking out good information so you can make an informed decision. And hopefully we can get all of our kiddos protected in our community so that we can get to a better place on the other side.
And I can say a couple of things. I just think I think one piece of information I think you should know is that it says for me, like I'm not paid to give vaccines. My kids, I have a 12 or 10 to 12 and a 14-year-old, and I think that it's a wonderful time. We can involve children in this decision process. We can enforce altruism and thinking about our peers and other people that we care for, teachers, grandparents. But I also think that it's nice to educate kids on how public health works, how these vaccines work. And I'm optimistic that knowledge and obviously the science, and it's a wonderful time to exist and to teach about this. And so as a pediatrician, I get to teach about it in the room every day. I encourage people to talk about their concerns with their docs. Most of the time that's behind a closed door. And I like talking about it. I like talking to people in a room about COVID vaccinations, why I chose to do it for my children. And I think we all have to come to our own sort of personal algorithm, a way of weighing the pros and the pros and the cons. And I'm excited to be at this point where we can actually affect change. So I'm really optimistic about the next 6 months. I'm hoping that we get to a place that's better than where we are right now.
All right, well, thank you all so much for your attendance tonight. Thank you to the panelists who have extended your work days. I think most of you probably talked about COVID all day at work and then talked about COVID some more after work. So I personally appreciate that very much. And I want to make an announcement that there is a link to the conversation here that will be available on the Buncombe County Facebook page after we conclude. And if you just can't get enough of this information, there's also a fireside chat today at 6:30, so in 3 minutes, on the North Carolina DHHS website, and that is featuring Mandy Cohen and Dr. Rashida Monroe, and it's facilitated by Molly Grantham. So thank you all very much for your attendance tonight, and we really appreciate all of the comments from the panelists. Have a good night.
Thank you, Megan.
Everybody for your time.
Thanks.